work that I've been doing on food system transformation, we have been looking at the impact of non-communicable diseases. Why did we do that? Because we found that this is the #1 cause for mortality and morbidity, not only in international terms, but also here in Europe. So many cancers, heart-related diseases, diabetes, even Alzheimer's, actually have causes that can be tackled by dietary shifts. So I believe that it's really important to look at this interface between food and health.
Working with all actors or all consumers and working with those pockets of people and disadvantaged groups, for me it's vitally important. Across Europe, 20% of the population lives in poverty, and they're quite often the forgotten group of people in terms of public health promotion activities. So working with those groups for me is really important.
So in our analysis we looked at different regions and also population demographics across Europe, and we found actually quite interesting differences across Europe. So for instance, the northeastern or also eastern parts of Europe are more affected by these non-communicable diseases and the negative effects they have on our life, not only in physical but also mental terms. We also found that in terms of demographics, in certain areas women are much more affected, or even children are more affected. Obesity, which is a root cause of many of these non-communicable diseases, actually affects children already. So we're not only looking at older ages, we should actually be looking at different age groups really during the entire lifespan.
There's so much technology, there's so much support out there for people to eat a healthy diet, to prevent non-communicable diseases, but sometimes they require a certain level of your economic situation or education level, where a lot of people from these different groups, they can't afford to. They sometimes can't afford to eat healthy, never mind any of the technology that's there. That's fantastic technology. So some of the work that we're doing at the University of Reading is working with these hard-to-reach disadvantaged groups. And we've got some very nice projects ongoing at the moment where we're working with the disadvantaged communities within Reading, London, Brighton and Plymouth. We're working with some of the older adults in this co-creation piece about having that conversation with them about what are those challenges, what are those barriers to healthy eating.
We also found that the food environment is really important. So like our social environments, how we actually purchase food, how we process food, how we cook, with whom we cook, makes really an important difference what kind of foods we eat and how that eventually affects our health.